using Skyla because Skyla had surgery to repair her extensor tendon in her index finger. So it'll just kind of give you guys a sense for how to measure somebody who might have an injury. And you're cleared for all passive range of motion, correct? And then active flexion, so just no active extension.
Yeah.
Okay, so for radial and ulnar deviation, you're going to start the patient with their forearm flat on the table, elbow a little bit bent. And to assess the end feel, you're just going to grasp at the distal carpal bone row, so the distal carpals, and then you're going to take the wrist and bring it into radial deviation and ulnar deviation. Okay, and again, so first just kind of getting a sense for end feel. Your landmarks for assessing, you're going to find the capitate is where the fulcrum is going to be aligned. So, do you remember how to find the capitate from yesterday?
Third
Yep, so third metacarpal, or what's the other path? Lister's tubercle, yep. So you can either find Lister's tubercle on the posterior aspect of the radius. So there's her Lister's tubercle. I'm going to drop into the little divot. The first row will be lunate if I flex, right? And then if I go a little bit more distal and flex, that's going to be her capitate. Okay, so you'd find the capitate for your fulcrum. And then you're going to align the stable arm along the forearm, aiming towards the lateral epicondyle. Okay, so that's the bony landmark you're going to use for your stable arm, the lateral epicondyle. Okay, and then the moving arm is just going to align with the third metacarpal, and then you're going to bring her into that radial deviation and assess how much mobility she has, which is around 25 degrees. And then to go into ulnar deviation, the opposite direction. And again, so what I noticed is I lost my lateral epicondyle landmark, so you just have to be careful to make sure that stable arm stays towards your bony landmark of the lateral epicondyle. And she's measuring around 40 degrees there. Okay, so that's radial and ulnar deviation, and we would expect a firm end feel for both of those as well. Okay, so now, let's see here. Can I have, Chelsea, do you mind just getting to the next slides here? I just want to make sure I don't skip anything. So we do, okay, so MCP, flexion and extension. Okay, so for the MCP, to assess for flexion, you can have the person with their forearm supported on the table and their wrist in a neutral position. And then you just want to assess first, stabilizing the metacarpal and moving the phalanx. You let me know if there's any pain, okay? Yeah, anything there? No, you're okay? Okay, good.
It's probably good there.
Okay, okay. All right, so then we're going to place the fulcrum at the head of that metacarpal and align it with the radius. Okay, and then from there, you're just going to follow the phalanx. You let me know. Okay, right about there?
You're good.
Okay. Okay, so she's at 65 degrees, which is pretty darn good. Okay, and then again, you can just maintain the goniometer where it is. Oops. And then you can bring her up into extension. You let me know.
So it looks like this one's harder with the like.
It is, yeah. You know, I think that, you know, I think it would be better for extension to use more of a rounded goniometer so it can kind of follow the contours of the MCP. So I'm gonna switch that. Okay, so let me just assess first. Okay, so I'm stabilizing metacarpal, moving phalanx. You okay there? Okay, good. So that's where about I feel her end range of motion is. And it feels like a firm end feel. And then I'm going to place, again, the fulcrum right at the head of the metacarpal. I'll line it with the radius and then bring her up from there. Okay. So you okay there?
Mm-hmm.
Okay.
That's pretty good.
Okay, good. And then we get 50 degrees, about 50 degrees of extension. What did you get in your?
I don't remember.
Okay, okay. I was like, are you improving?